Hi everyone, thank you so much for joining us. This is Val Casano, Performance Improvement Specialist with CDHS. We are going to be hosting our first Performance and Partnerships Exchange webinar today. Our focus measure is the Child Welfare Timeliness of Response to Abuse and Neglect CSAT measure. If you have questions, please type them into the chat box, and at the end of each section, we'll read the questions to each of the speakers. Today we're hosting this webinar by myself, Valerie Casano, and Paige Roseman. She's a Child Protection Services Manager with the Division of Child Welfare at CDHS. We're also having three speakers, Kim Castellano, Holly Laden, and Angela Mead. In today's webinar, we're going to go through the introduction to the Performance and Partnerships Exchange. We'll review the Child Welfare Timeliness of Response to an AN CSAT measure and discuss lessons learned. And then we can go through any other questions or comments you have about the exchange or anything you heard today. The Performance and Partnerships Exchange is brand new. This is the first one we've done. It's a peer-to-peer exchange focused on one county-facing CSAT measure chosen by county human services directors each quarter. Once the measure has been chosen, state and county CSAT staff meet with well-performing counties to gain insight into this measure. This culminates in a webinar and a lessons learned package which will be available to counties. The Lessons Learned package will be available to all counties on the County Portal CSAT tab, and I will notify you once it's complete and on the portal. The Lessons Learned package includes lessons learned from each well-performing county, tools used by these counties to enhance performance, and a summary document which highlights lessons learned across small, medium, and large well-performing counties. In April, County Human Services Directors voted that we would work towards performance improvement on the Child Welfare Timeliness of Response to Abuse and Neglect CSAT measure. The numerator for this measure is the number of initial child protection assessments where the assigned caseworker made initial contact with the alleged victim within the time requirements set in rule. And the denominator for this measure is the total number of child protection assessments closed in the month. We chose well-performing counties based on CSAT timeliness data and data from the Administrative Review Division. This graph shows performance across the state on CSAT timeliness data. The goal for this measure is 90%. Currently, the state is averaging 88.5%. The participating well-performing counties performed at 90% or above throughout the past year. The participating counties also performed well on two ARD review questions. Was the alleged victim interviewed or observed within the assigned response time? And did the county make reasonable efforts to interview or observe the alleged victim within the assigned response time? Based on the timeliness and ARD data, we ended up visiting Broomfield, Custer, Fremont, Jefferson, Larimer, Park, and Teller counties. We will hear from Park, Fremont, and Larimer counties today, and we're first going to hear from Kim Castellano from Park County.
Hi everyone, this is Kim Castellano. Thank you for having me here to speak with you. Park County is a small county. We have about 14,000 people in our county, of which about 2,000 of them are children. And what we're seeing is we're actually having a reduction in children in our county with the economy and lack of jobs in our community.
Hey Kim.
But yes.
You have a bit of an echo.
It might be the split computer, but I'll move over here.
Okay, that's much better. Thank you so much.
Okay. On the timeliness of data, we were 100% of our 77 assessments between June 2013 and May 2014 in timeliness of response. And the reason I think that we are with that is our team approach that we do within our organization. Everyone is a generalist, so we have very specific duties, like we'll have foster care, family engagement, but we also train them to take referrals, respond, and do assessments in there. When we get a referral in, we use the enhanced screening tool, which helps us with the data before we meet. As a small county, we are unable to do red teams at a specific time and at a specific location. Our offices are 45 miles apart, and having only 6 staff members and children spread out all over the Front Range in homes or with parents, we often do these by phone, and we may have 1 or 2 in the office and someone else either on a cell phone or an office phone in another location. What I think helps us is we don't wait till the next day to red team them. Obviously, with an immediate, they will go out as soon as we get it. But we will do a red team when we can get the 3 people together by phone or in person. If we don't have the staff on site or availability, we also use individuals like our child support staff and eligibility. They have been trained in accepting referrals or have been a case aide in the past and have some reference to what we're doing.
Hi, Kim.
Hello.
Which slide would you like us to be on?
Right. Well, I'm still talking about some of what gets us to where we are with our timeliness.
Okay, great.
And actually, if you want to flip over to the next screen, that'll be fine.
Okay, prompt me when you'd like me to switch.
You bet.
Thanks, Kim.
So you go ahead and switch to the next one. Once we get a referral and assign it based on the timeliness criteria, we will use our staff as well as assistance from other staff, and we're more than happy to help out other agencies. Teller County and Summit County are ones that we work with very closely because some of our parents or children may be in daycare centers or schools in the other county, and the parents may reside in our county. Being as large geographically as Park County is, we also use our staff based on that. If I receive the referral today in Bailey and the family actually lives in Hartselle, we may use our staff over in Fairplay to go and do the face-to-face. Also, too, if we have multiple family members that are, and they're always spread out up here, as I'm sure they are down there or anywhere else, we may assign a primary and secondary onto the cases to help with that. If we have families that sometimes are on vacation and out of state, we've actually contacted DHS offices in other states and asked them to help us with our face-to-face meeting with the family. And that's been a great benefit to us. And, of course, we have to reciprocate and do the same thing back. If you'd like to switch to the next screen. Some of the reasons that we feel that we get that 100% across the board is the timeliness begins with the enhanced screening. We're getting accurate information up front. We also have a very good relationship with our law enforcement agencies. We are asked to train all of their new officers so they know what we need and what our role is, and the same thing with my staff knowing what their role is. So we're getting a lot of great information from our mandatory reporters that I think a lot of large agencies, when you don't have that face-to-face with officers, may not be available in it. We use the enhanced screening tool, which has been very helpful, and especially helps when I have someone like the child support person who was a case aide in the past, who for some reason had to take it because no caseworker is available. They have that enhanced screening tool to help them fill out the form and get hold of us. Also having the iPads now and additional information, we can get into trail and remote locations when we're not in the office. Once we get that referral, the phone call is made wherever our staff is to get them available for a red team. Another factor that plays in this is we work 410s only, and the county is closed on Friday. It was a decision made by the county commissioners. So that becomes very important for us on screening it as soon as possible, because if we get a bunch on Thursday at 3 o'clock, we're not back until a Monday. The red team takes place, we get the information, make the timely decision on how soon we need to get the face-to-face done, and assign the staff as needed to handle it. Is it a one-person or a two-person case, and how can we help in getting that done? All of our staff participate. They put this on here on-call. We're on call Monday through Thursday. For our staff, we do pay staff to be on call on the weekends, and none of our staff have chosen to be on call. They like their 3 or 4 day weekends off, and we do have a Denver DHS worker and a Jefferson County worker who that handle on call on the weekends. So we have a lot of cross-training with them, and obviously they have contact with supervisors on the weekend if a decision needs to be made. And with Red Team, and again, we're right back out to handling the timeliness based on that communication between all of our staff members. If you want to flip to the next one. Okay. We also make sure that our caseloads are manageable for them and distributed out. We have a lot of issues with transportation and driving time. It can take us over 2 hours to get from Bailey down to the Guffey area down by Fremont County. So we have to calculate the time and response, and again, who's going to get there. Wintertime, when we have passes that are closed, it complicates it more, and so all of that counts into how we're making those assignments in there. If we find that a caseworker is overload, having to do a lot of forensic interviews down in the Denver area, we'll assign other staff. We don't have we have a specific person who does intake, but they don't get all of the intakes. Again, it's based on our need and making those face-to-face with these clients as soon as possible. All of our staff, you can switch to the next one, like I indicated, are cross-trained. We also anticipate people leaving, just small county issues. So, for example, we have someone that has already been trained and through the academy as a supervisor that can fill that role. We just sent another case aide through the whole academy process so that they could step in to a caseworker role. So we hire our case aides with the same standards we do for a caseworker, and plan on moving them up as needed in there. And I think that's all I have open to questions.
Thank you so much, Kim. If anyone has questions, you can type them into the chat box.
I'm not seeing any, so unless I'm missing them.
We don't have any questions yet, but if they pop up, then I'll let you know, Kim.
Okay, great.
Thank you so much. All right, up next we have Holly.
Hi, everybody. This is Holly Laden. I'm the intake supervisor in Fremont County. I've been in this position since April of last year. I've been with the department going on about 7 years. So I'll just kind of jump right into it. Our first slide was the same as Kim's and just shows where we're at in terms of numbers and our timeliness. I don't know if we can move to that slide. There we go. So we're sitting at 95% timely right now, so we even have some room for improvement, but that's just our slide, and everybody's probably already looked at that, so we can jump to the next one. There's a couple more numbers. Did we interview the victim within the assigned response time, or did we make reasonable efforts to interview the victim within the response time? Not really much to say on those. There's our numbers. So now we'll get into the practice. So one of the big things that I try to do with my team, because I remember what it's like to be an intake worker, is every day after Red Team, we hold Red Team every morning at 9 o'clock. We have someone from each team in child welfare come to Red Team. So there's someone from intake, there's someone from ongoing, there's someone from resources, and there's someone from permanency and support, so that we can really get that kind of 360 view from the whole Department of Child Welfare on every referral that we get. So after Red Team, I meet with my intake team following that every morning to sit down and talk about what was assigned in Red Team and where those should go. The reason that we do that, years ago we used to just kind of follow the list, well, who's up next to get a referral? And I think sometimes that's okay, but it is nice to hear from the workers where they're at with their workload. Sally might have 10 referrals and Johnny has 15, but Johnny's are kind of ones and dones, and Sally's having to file 4 DNNs. So I don't think the numbers are necessarily an accurate account of where the worker is at in terms of their workload. So sitting down as a group to discuss everything that's been assigned, where those should go, who should take what, I think really takes a lot of pressure off the workers and lets them be a part of the process and really speak up to say, I can't fit another one in this week, or I'm good, I can take 2 of those that have been assigned. And it's a really helpful practice, and I know that my team really appreciates that. So that's one of the first things that we do. We can move to the next one. So supervision expectations. The timeliness of response is used in all of their evaluations. So for the first year, they have their performance evaluations every 3 months, and then after that they're yearly, and those are talked about in all of their performance evals. One of the huge things for us in Fremont County is that our administrator, Stacy Quiddick-Russell, she pulls trails reports every single Monday and routes them through the supervisors. One of the reports that she pulls are the timeliness response, so we see if we've missed any time frames, and also we print out running totals of where all of our assessments and FAR cases are at. So I'm able to meet with my team. I meet with them every Monday at 8:15 in the morning to go over those reports together every single week. So I can tell every worker individually, you have this assessment that's at 45 days. What are we doing? And we come to a decision right there. So when stuff starts to creep up towards 60 days, they're aware of it. They get a weekly update on that. Hey, you're at 30 days. Hey, you're at 37 days. And then obviously if they've missed a time frame, that is addressed immediately right then and there with that worker. So they're constantly kept up to date on where their caseloads are, what the numbers are, and what they need to do. So those reports are hugely helpful. We really stress that they have to continue to make their efforts within the time frame. So if it's a 5-day, they have to go out every 5 days. That's really stressed. And then also we have really good relationships with our community partners down here. So probation, our early childhood folks, we're able to reach out to those people and ask for information on a family if we're doing an investigation and we cannot find them. Our workers really get creative and they work hard to track down these families. And again, it's always reframed back to child safety. It's not about just putting in a rock and, well, I made my attempted contact, so I'm good now. They really take child safety seriously, and so they want to find this family. And our community really helps us do that. We can go to the next one. So I have the intake expectations that I tried to type out. They're pretty, maybe more lengthy than some, but I wanted them to be very detailed so there's not any questions. We can move to the next slide so we can see that. These are given to all of the intake workers, and they're signed. We go over them together, and this is a changing document. Workers can come in and they say, you know, hey, I think this should be added to the expectations, or this really isn't relevant anymore. So this is a constantly changing document. It's been changed a lot, and then we'll go over it again and sign it again. And I just want to make sure that I'm not putting any expectations on them that I haven't made 100% clear to them. Obviously, that wouldn't be fair. So I tried to type it out very detailed, and it seems to be helpful. All of my workers have this hanging in their cubicles, you know, if they ever have any questions about what is expected of them. So, I mean, pretty straightforward, but pretty detailed at the same time. The next one. Okay, data tracking. So we have a schedule set up for phone coverage within intake. We have 2 screeners on our team because we also have adult protection on my team. But both screeners take child welfare calls. So we have the 2 screeners, and then we have caseworkers that back up those screeners. Everybody has a phone day where they're in the office to cover phones. So whatever worker takes the referral, they have to enter it into trails so that we make sure all of the information is entered correctly from the person who took the call. And that person has to attend red team the next day. So if your phone coverage day is Wednesday, then your red team day is Thursday, so that you're there in person to present all of the referrals that you took. It's really hard to present a referral that someone else took on the phone, because inevitably, we all know from red team or staffing, there's a million questions, and you say, well, I don't know, I didn't take the call. So we make sure that that person is in red team. Contacts are entered when a person gets back from the office. This doesn't always work out because sometimes you don't come right back to the office. But a habit that my workers get into that I talk to them about is to schedule 15 minutes after every visit, 10 to 15 minutes, and that's your documentation time, and your rock needs to go in right then. There's no reason that that can't happen. All rocks have to be entered within 48 hours, and I do spot check on that throughout multiple times throughout the week. It is difficult, I think, at times, but that practice has helped us so much. If we have to look at a case after hours, if the on-call person needs to get in trails, those rocks are always there. I'm sure everyone has had the pain of looking up a family and you know we have something open, but there's no rocks entered and you have no idea what's going on. And that's just unacceptable. So rocks have to be entered in within 48 hours. We also have the rock expectations guide, and this is taken from, you know, ARD and all of the other audits we've had and addressing child safety, that this document has been put together. So we can click to the next one. And this shows all the information that needs to be entered in a rock. I think when workers first see this, they think, oh my goodness, you know, that's a lot, but it becomes obviously habit. We all know as supervisors and seasoned caseworkers that this is what you put in a rock. But to a newer worker, a lot of these areas get missed. And so this is just a good guide for them to use until they get in the habit of, you know, what needs to be entered in. And I'll come back to this again, but this is something that we print out and give to all workers on intake, ongoing resources on all of the teams. This is the expectation for rock notes. So we can go to the next slide. Let's see. Okay, so more data tracking. So I review all of the face-to-face rock notes in trails for assessments to make sure that they meet that criteria from that prior checklist. But the really big thing, I think this next slide, this is the biggest part of what we do in Fremont County that I think has really changed the way that we practice intake and has helped us have these high percentages. I created this face-to-face time frame tracking form. And then I give this out to every worker whenever they have an assessment assigned to them or a FAR case. So after Red Team, when we've met and we've decided who's getting what, I fill out one of these forms for all of those referrals that are being assigned. So I fill out what worker is getting it, what the name of the assessment is, the date that we got the referral, what the time frame is, so immediate, well, I don't fill these out on immediates because obviously we're going out on them, 3-day or 5-day. And then I write in their form, this is the date that you have to have your face-to-face. And that's helpful for them because then they have it right there in writing. I don't have to worry about workers making a mistake. Oh, I counted wrong. I thought it was due on Friday, not Thursday. Then I'm the gatekeeper of that, so I know that they're getting the right time frames given to them. We've also recently added when the 30-day extension is required by. If anyone's noticed, you get the alert in trails as a supervisor that says this assessment is over 30 days without an extension. Well, that's not helpful because it's already come and gone, so we're outside of the requirement. So I also write in there, this is when the 30-day extension is required by, and they mark that in their calendars when they get this tracking form from me. So they can mark 30 days from now, Johnson extension due, if it comes to that. So we never have any go over 30 days without an extension. So once I give them this form, they do their piece. They go out and see the family or attempt to see the family, and then they have to fill in the rest of the form and give it back to me. Excuse me, I'm kind of battling a cold here. So they fill in the line that says face-to-face attempted or completed, and they put the date that they did that. And then down towards the bottom where it says rocked, they'll check that off, and they have to attach all of their rock notes. They print them out and attach all of the rock notes during the initial time frame only. I don't want the rocks from the entire assessment, just from the initial 5 days. And the reason I want those is because I want to make sure that their rocks follow the rock outline, first of all, and the documentation is appropriate. But also it's a way for me to monitor that they're calling that family on day 1 or day 2 at the latest. They're not waiting until day 5 to call that family and say, hey, by the way, I have to come see you today. We take that very seriously to be family friendly, give them time to schedule an appointment with us if appropriate. Sometimes we obviously don't want them to know we're coming. The other thing that's on there is the genogram. Every intake worker has to sit down with the family and do a thorough genogram. And they have to get input from the parents as well as the children, excuse me, if the children are able to give it. This has come to be very, very useful for us for those cases that go maybe farther than we think they're going to go, or something turns bad. And then we have a nice kind of family tree to start with, to start looking at supports or possible placements. So that has to be attached as well. So once they get all of that done, they attach their rocks, they turn it back into me. I look it over and sign it. I give them this tracking form and the genogram to put back in the file, and I keep a copy of it. I hope I explained that okay. This is, like I said, this is the real piece of paper that I think has really upped our practices in intake, because it's very clear when the time frames are, what the expectation is, and everyone is on the same page. And again, I'm the gatekeeper of that. So if there's a mistake made, that's on me. Okay, we can go to the next one. Okay,
Holly,
so when
you're
in the
at the
field,
5-minute mark.
Yeah.
Okay.
Okay, thank you. My workers love to use their surfaces. That's what we have in Fremont. So they do a lot of documentation when they're out in the field, and that really helps them, meet that expectation of rocks being entered within 48 hours. So that's helpful for them. When they close an assessment, they have to use the closure summary checklist, and that was those requirements of what needs to be included we got from the state on that. So that's what that next slide is. So all of my intake workers have this closure summary checklist, and I have to read through all of their closure summaries very thoroughly to make sure that all of these things are included in there. And that really becomes very helpful when we're doing red team and looking at past referrals, and we can see, well, what happened in that last referral. It's all in there. All you have to do is go to the closure summary, and you get all the information that you need. So then we're able to make a good decision for the new red team that we're doing on this family. Okay, that's my last slide, so I don't know if anyone has any questions, and I hope I didn't just ramble and gave some good information.
Thank you so much, Holly. This was really helpful. We have one question, whether the PowerPoint is going to be available. The PowerPoint will be available to you on the county CSTAT portal, and the PowerPoint will also be available to you. And all of the documents that Holly just mentioned will be available to you on the county CSTAT, or on the county portal CSTAT tab as well, in a Word document, so that you may use them and edit them in a way that fits the needs of your county. So that is no problem. And then, Kim, we have a couple questions for you.
Okay.
First is, what is the average size of your caseload in Park County?
Cases or assessments?
Assessments.
Our assessments, we have, well, 77 in a year, and that would be normally for one case intake worker. But with management, I would say we don't have more than 6 going at one time.
Okay, and we have one
Based
more.
on the timeliness and being able to. Okay.
Do you conduct red team by phone? Since
Yeah.
you do it immediately after receiving a referral?
We do, because we're spread out 45 miles apart, and based on visitation and court and everything else we have to do is ongoing, as well as foster home, ICPCs, APS. We get 3 people either by phone or in person.
Thank you so much.
Very rarely can I say at 8 o'clock in the morning we're going to have a red team.
Okay, thank you. Are there any other questions for Kim or Holly? All right, we'll take questions at the end of the next section as well. And up next, we have Angela Mead from Larimer County. Angela?
Good afternoon, everyone. It's a pleasure to be here. Yes. Oh, good afternoon, everyone. It's a pleasure to be here. I'd like to compliment the creative strategies of Park in Fremont County in meeting their timeliness. I learned some things today. You might want to share some of the practice wisdom with our crew. So I was asked to do a brief presentation on how Larimer County is doing relative to meeting the timeliness in our response and some of the practice strategies that we're using. If you move to the next slide, this slide will give you an idea of our performance to date. It takes into account the assigned assessments from June 2013 to May 2014 and what our performance rating was relative to meeting our response times. And you can see today, as far as May 2014, we were at 94.2%. We are one of the big 10 counties in Colorado. We do differential response. We had about 1,072 assessments between June of 2013 and May of 2014. 965 of those assessments were timely. And on average, we have 90% of our assessments are timely throughout the past year.
Hey, Angela.
We have a number of strategies. Yes.
You seem to be fading in and out a bit.
Oh, I'm sorry.
Is there a way
Okay.
to speak closer to the microphone?
Is this better?
Thank you so much. It's much better.
Okay, thank you. So we have a number of practice strategies to help us maintain our performance. First and foremost, we monitor our compliance through the use of monthly crystal reports. And then based on those results, we will do supervisory inquiry, and then our admin team is consistently doing follow-up, and then we're tracking our workload assignments. Anytime we see a slip in performance, the first thing that supervisors will do is begin to identify the causes, what's behind that. And if you look at this data chart, you can see that there were months through this time period that we were being reviewed where we had some slips in performance. And so when we see that happening, that's important for us to get on it right away. Sometimes some of the causes that we'll see, they might be workload related, they might be just staff related. Sometimes staff are maybe struggling with managing their time, organizing their work and managing priorities, and so when supervisors have data available to them, they can begin doing some strategies with the worker to get our performance back to where it needs to be. Sometimes there are barriers outside of the agency that can create problems. I think one of the earlier presenters talked about our relationship with law enforcement. We have to do joint investigations with them on high-risk assessments, and they don't have the same timelines that we have. So we make it a point. We have really good working relationships with our law enforcement here in Larimer, and we make it a point of talking with them about the regulations that govern our practice and help them to understand the rationale for why we have these performance standards. And then get into some problem solving and solution building around them working with us so we can meet our standards of performance. An example of that, like sexual abuse allegations, those generally will have timelines that we need to respond to that law enforcement isn't particularly feeling like they need to meet. And this would be a situation where a child may not be in imminent danger, but there is an allegation of abuse, and law enforcement might be more concerned about approaching their investigation without compromising their case. And so we have to have some important conversations around how do we get our work done and still meet the expectations of our independent departments. We have quarterly meetings with the sergeants of crimes against person teams, and so we'll troubleshoot some of those issues when they come up. Staff, we encourage staff to document their attempts at making contact. Sometimes we have failed attempts, and we have set standards in how we want to manage those for staff. Staff are getting really creative in how sometimes some of our referrals come in and we may have some complications around knowing where the family is, or maybe they've attempted to locate a family by a reported address by a reporting party, and they're not having success around that. And so they're looking at other sources of information to try to determine location. So it might be a phone book, if the family is getting public assistance benefits, checking with our public assistance records to confirm the address. Sometimes they're getting into Facebook and are able to identify associations of the family that maybe we have information about, and then we can contact them and just confirm an address or something like that. So there are a number of different things that are happening to help first locate the family and then ensure that we're making those responses timely. We work with our management team to address the complications related to turnover through doing some increased coverage, and this requires a lot of teamwork. In Larimer County, we have 9 individual paired teams that respond to child abuse and neglect reports, and then we also have an after-hours response team.
Hey,
so,
Angela.
Occasionally, if we have yes.
Do you want to prompt me and let me know which slide you'd like me to be on?
Oh, I'm still on the slide.
Oh, okay, perfect.
I haven't.
Okay.
Okay. So sometimes, with we'll bring in an after-hours team to help us with our response. if we're having a coverage issue that's resulting from turnover. And I think first and foremost, since we are a DR county and we've implemented enhanced screening and red teams, those two functions have really played a critical role in helping us to get out on our cases more timely. Those two processes really help us to do better with responding to situations that require a child protection response and not responding to those situations that don't require the response. And then also making sure that we're determining the appropriate response time. And I think it should be noted that the initial response is not the only measurement of safety. It's the combination of our initial response coupled with subsequent contacts, as long as the assessment is open, and the quality of the contact that's a better measurement of safety. So we want staff to know that the importance of all of those things, and it's not just the numeric number that we're using to measure their work by. You can go on to the next slide. So this next slide just gives you an idea of what the ARD data is telling us about our practice. So we 88.7% of our alleged victims were interviewed and observed within the appropriate response time, and then 100% of the time the county had made reasonable efforts to interview or observe the alleged victim within the response time. Next slide, please. So the other thing that we do on our executive team, we frequently review our county scorecard and discuss performance. We particularly want to know about the things that are getting in the way of workers being able to meet the standards that we've put into place. As I mentioned to you earlier, teamwork is paramount. We had a recent bout of turnover, and in one of our teams, they lost 4 or 5 workers, and so we had to call on the help of another team to pick up new assessments so that the workload was manageable for the other team who had experienced the turnover. So having that culture of camaraderie and support is really important. And as I mentioned too, if we get into a situation with a worker, if they've made numerous attempts and have not made contact with the family and they're down to the wire, sometimes they will make a request of our after-hours team, and they'll go out and attempt contact after your traditional business hours. And more times than not, after-hours will be successful in locating the family because it is later in the evening or it's on a weekend when families are more likely to be home. Okay, next slide, please. So supervision, I think, plays a critical component, obviously, in monitoring how we're doing relative to this outcome. Supervision will require that the intake workers meet the response times and they document that contact and trails within 3 business days. There is an expectation for timeliness, and it's made clear to all of our new workers. And I think it's a value that we all hold dear to our hearts. We know that that's the best way to ensure safety of kids. And then to be even more creative, we've come up with some incentives that we use to promote timeliness along with the other measures. Supervisors and practice coaches will cover requirements in orienting our new staff. We've built in quality assurance controls to monitor our compliance. We're set up in such a way that anything that requires an immediate response, we have workers that are in a rotation, and they're available at any point in time to respond to immediates. So we don't generally have issues with the immediate response. And then, of course, the remaining referrals will go to our red teams for determination on whether or not we'll respond, and then if we do, what the appropriate response time should be. Each year during National Child Abuse Prevention Month, our caseworkers are rewarded for compliance with multiple measurements, and timeliness is one of them. And so a worker may be identified as having superior performance and then get Intake Worker of the Year. We'll look at team performance, and so we will select a paired team of the year, and then we'll look at red team of the year. And staff will be recognized at an awards ceremony where there's some staff or some recipients of some awards are recognized at a community dinner that's hosted by a nonprofit agency, and then they'll get gift cards and that sort of thing. Next slide, please.
Angela, could you speak more to
So as I mentioned, you know, supervisors are, yes?
I was just wondering if you could speak more to the incentives that you use to promote timeliness. We had a question about that.
Okay. So it's probably where we give out the awards in April, and it's around February, March where we start gathering data on individual workers, pair teams, and our red teams. And they start pulling performance measurements, and it's generally a cluster of performance measurements that we're looking at. And then based on superior performance, those people are selected to receive the incentives. And we've been doing that a number of years now, which I think has been really nice. So this slide talks a little bit about supervision expectations. Oh, let's see. Oh, next slide, please. Sorry about that. So the supervisors continue to review outcomes at least once a month with all of our caseworking staff. All the caseworkers know how other caseworkers are performing, and caseworker performance is pretty transparent. We have, in Larimer County, we have a group supervision model, and so this makes their work more transparent, and it creates this culture of peer accountability. What we know is that successful engagement of families lends itself to in-depth information that helps us to understand what's happening with families in our assessments, and these will be key indicators that sufficient contact is happening with the family. And when they're sharing their work in a consult in a group supervision model, it becomes very apparent. So, you know, we think that that kind of transparency is really holding staff accountable for good practice. Next slide, please. So Larimer County, we're fortunate to have a new model of training. We have 3 practice coaches, and they are dedicated to training new caseworkers on best practices. The coaches that we have on staff here have all been caseworkers in child protection, so they have a lot of experience and insight and understand the work, which I think is a great asset in helping to support new workers in the practice. They don't have a caseload. Their primary job is to help facilitate learning that's already happened for new workers coming out of the training academy, to take them into the field, to demonstrate the way the work is done, to observe them doing the work, and then to offer continual support as they're doing it over their first performance year. And this will involve them attending face-to-face contacts with new staff to ensure quality work. They have a great system. It provides a great system of support for all of our new staff. And it's also a great asset for supervisors, because supervisors have very busy jobs, as you all know, and to have coaches available to work with our staff helps to promote consistency in our practice and making sure workers are getting what they need to be successful in the job. They can also do a lot of troubleshooting with new workers, so they help them to learn how to manage their time, how to organize their practice in such a way they can get all the things done that they need to get done. And then if they're having areas in their practice where they're really struggling, just really helping to strategize with them different ways to approach their work. We talk in Larimer a lot about, instead of just working hard, it's about working smart. The other thing that happens is that, well, our supervisors oftentimes will go out in the field with new workers and actually observe them doing their work. And this helps a supervisor to have some deeper appreciation for their skill level and areas of their practice they may need to refine. And coaches are also available to work with veteran staff who may be struggling in areas of their practice. You know, we worry a lot about secondary stress and burnout, and you know, sometimes a veteran worker may need just a new boost and get a new refresher on ways to approach their work, and this will help, hopefully, to help them manage some of the complications with their job and to feel good about their work. Next slide, I think, is that it? Is that my last slide? Oh, okay, no, it's not. Okay. So this is, as I mentioned to you earlier, screeners we've been doing DR, we've been doing enhanced screening and red team. And what we've done with our screeners is we've required them to attend enhanced screening training. This is an area of our work that's very important because it really sets the stage for making determinations about whether or not we need to respond, and if we do, what our response time should be. And when screeners attend red team, they get a sense of the importance of why they're asking certain questions and what can happen if they don't ask certain questions. So this really helps to refine the practice of screening. The enhanced screening tool is also used to collect important and relevant information during a referral. We have our red teams meet 5 days a week from 8:30 to 10:30. We have 3 independent red teams that meet at the same time, and they're reviewing all of the referrals that are non-immediates that come to them for review. And then they'll organize the information into the framework that we're all familiar with, and then it's the analysis of that information that helps to inform whether or not we respond and what the response time should be. So those are critical functions that lead up to determining the safety for kids and making sure we have a good response time. The screeners, when they're doing enhanced screening, all of their calls are monitored for quality assurance. We do have a practice coach position in our hub that delivers a county design training, and I think that practice, in addition to what the state will be providing in terms of enhanced screening, is really going to help to improve our screening practice and help to inform the response in red team. And having those calls monitored is ensuring that we're getting the best information we can at the referral stage. Next slide, please.
Angela, that is your last screen.
Is that it?
Yes, but we did have one question on the previous screen.
Okay.
This one. Someone wanted to know how all caseworkers know how others are performing.
Well, I think that in the group supervision model, you know, when a caseworker comes in to present their completed assessment, what they're talking about is the work that they've done with that particular assessment, and it's through exposing the information that they have about the family. It's a reflection of the quality of their work. Because if they come in and they're presenting that assessment and there are a lot of gaps, then there's worries that maybe they're not making sufficient contacts with collaterals, or they're not having the right kinds of conversations with families to help us appreciate whether or not safety exists in families, or what's happening to mitigate risk and that sort of thing. And then the supervisors, as I mentioned earlier, are monitoring their compliance around face-to-face and initial response.
Thanks so much, Angela. Do we have any other questions for Kim, Holly, or Angela? All right. We'll move on to the next slide, which is Paige Roseman, and I'll let her introduce herself.
Hi, this is Paige Roseman, Child Protection Services Manager, and today I'm just going to highlight different aspects of each of the county practices that we observed during the visits. And I also want to make sure that I thank Corey Elder, my staff member, for all of the work that she did to help make this project happen in facilitating the site visits. All right. So the first slide here, sorry, I'm moving some items on the screen. So as far as practice goes, we as a state are really supporting both the enhanced screening and red teams. As you know, that this will be coming out in rule as an expectation for counties to participate. The enhanced screening process provides increased quantity and quality of information. This ties directly into your ability to locate families and to have the information you need to make good decisions about screening, timelines, what response times are being assigned. Red teams provides a different format for decision making. We now have a shared responsibility among workers and throughout our hierarchy. This really supports good decisions being made with that additional information that they were ascertaining through the enhanced screening process, and we really believe that this type of team decision making will enhance this process. After hours and on-call processes match county's level of need. In each of the site visits, this was really highlighted. We have counties that know what their demands are. They make sure that their staff are well trained, and they also compensate them for working after hours if it is a on-call type of model, or they have the actual team that is on after hours, and that is their sole responsibility. But we just have to make sure that each county is assessing what are their level of needs, because it would not, for a county that's only receiving 10 reports after hours in a month, it wouldn't be necessary to have a separate unit, but having those on-call processes that adequately compensate workers for their times really seems to be a highlight. Okay. So another area that was highlighted was cross-training staff. So taking a generalist approach to how we're training staff, ensuring that your entire staff can perform the intake duties. While this may not be as applicable to some of our metro county or larger counties, in other areas of the state, this is essential. It also highlights the need to consider geographical assignment of referrals. So if you have multiple offices in your county, utilizing where that referral may be located, or even where different staff may be residing, so that they can, on their way into work, on their way home, that they can initiate those assessments. County's internal expectation on timeliness of initial contact are more stringent than those in Volume 7. I think we really heard that in Fremont with the use of their different tools and the different expectations, where they made sure that they are checking on the timeliness even before it's becoming an issue with adhering to Volume 7. Supervisors. It seems to both channel up and down to supervisors with their accountability within the role that they're playing at the local county departments in order to be able to meet goal performance on this measure. So supervisors may request ARD or us here at DCW to review their processes in an effort to identify barriers. We're here to be able to support this process, so if you are having concerns, please contact your county liaison or staff either at ARD or DCW, and we'll definitely walk through your process with you. So timeliness of initial response begins with well-established internal timelines at each of these different critical decision points: referral, initial review, red team, and assessment assignment. So how in your county could that process be tightened up so that it leaves more time for the workers to get out in the field and locate these families and initiate the assessment? I wanted to highlight ROM. So ROM can identify individual staff or supervisor concerns. If you and your county do not have access to ROM yet, please let us know, and we'll make sure to hook you up with John Stasinski to be able to get login. But it's an amazing tool that provides you current information about whether or not individual units within your section may be struggling, or individual workers. So you can see on this screen here, this screenshot where you have 36 assessments that did not meet timeliness guidelines. if this was in ROM, you can actually click on that number and it will provide you every single assessment that was not met timely, what the due date was, when it actually occurred, and it provides you with the worker that was assigned. So again, any identified concerns can be timely addressed so that it doesn't impact this measure. So training creates consistency. The Training Academy provides that baseline, but we also heard about how county-specific training can address identified needs of the county and individual workers. Each community is different, and we definitely want to highlight that. So we provide the baseline through the Training Academy, and then really have to be dependent on counties to provide individual training and coaching to workers to best meet their community needs. This last bullet goes back to case workers being cross-trained and hotline intake and ongoing roles to help manage workloads and imbalances when they arrive. Tools. So the last one here is about tools. So I think Fremont probably had the best examples of tools, and there were a number of them that we're going to make sure are available to you, because there's no need to recreate the wheel. But what tools do is that they establish a standardized and clear expectation of what the work product needs to be. We know that child welfare is not prescriptive, but having this guide to assist workers, especially new workers, prioritize their work and be able to meet these expectations is essential. It contributes to efficiency and defines consistent practices. And also the ROC node, it's not only about the quantity of the visits, but really the quality of the visits, and I think these tools help in both of those areas. So this is that intake expectation guide from Fremont that we encourage counties to adapt for their individual communities. And those were all of my area. There was one question that has come up about we were not able to attend the ROM trainings. Is there a web-based training or someone that can train us? So the ROM trainings are still occurring. They are being offered regionally. As to date, I don't know of a web-based training for ROM. But I still do encourage you to get your login information. ROM is not difficult to navigate, and you can contact your county liaison to assist you with navigating through ROM until a training is available in your area. But again, we just want to support every county utilizing ROM. Were there other questions? Well, from the state perspective, I just want to make sure that we, again, thank all of the people that contributed to making this happen, and really want to ensure that this is a county process. While we know that we are charged with supervising practice, we really want to encourage this type of peer support, and really thank Val for bringing this as an opportunity. I'm waiting to see if we got any more questions before I hand off. Well, we look forward to your feedback. I'll let Val close up.
Hi everyone. Thank you so much to Paige for highlighting some of the things that we've heard from in the well-performing counties, and also to Corey during this process. I just wanted to reiterate that we will have a lessons learned packet available to you on the County Portal CSTAT tab that will include all of the tools that you saw in today's webinar, and will also include this webinar. If you are interested in contacting your child welfare safety specialist, please contact Paige Roseman at the email address that you see here. And of course, if you have any other questions, feel free to reach out to me anytime, and I'm happy to connect you with the appropriate staff. I wanted to take this moment to see if there are any other questions and to see how we can make this exchange valuable to you. This is our first one, and we'd really like to know how you would like us to go forward with this process. And we want to know the best way to make this useful for you. All right, well, we're not getting any other questions. So if you do come up with any, please reach out to me or Paige. Yes, we have one question. Someone went to the CDHS county portal and didn't see where this PowerPoint would be located. It's going to be located on the CSTAT tab. We have not uploaded anything to the CSTAT tab yet, but I will let you know as soon as it's up. Also, if you're interested in seeing the webinar, you'll be able to find that on the webinar tab as well. Any other questions? All right, well, we're not getting any further questions, so please reach out to me or Paige if you have any questions down the road. Thank you so much for joining us today. Have a great rest of your day.